Hi, Dave Summers here again with the greatest supply chain challenge in history, the development and rollout of the COVID-19 vaccine. I'm here once again with good buddy, close friend, former coworker, Sandy Vosk. Sandy is the president, founder, owner of Advantage Technology Solutions. Sandy, I think we're going to talk about metrics here today, but before we do that, I have to comment on your garb. You're looking pretty sporty there, dude. You're looking pretty snappy. Are you going out? You going to play tennis? You going to play golf? You a golfer?
Right. I wish I was going to play golf. I really do. I miss it so. And do you play golf?
Oh my God, no. My dad tried, and it was a big, horrible mistake. I'm not a golfer. No.
Well, if you'd ask my friends, they'd say the same thing about me. But despite that, I love the game and love to get out there and certainly love, going away with my buddies and just laughing and just enjoying being together, the camaraderie. So, and the reason why I thought this was appropriate today, especially because metrics are very important in sports, first of all, right? And in golf, it's about handicap. It's about how far you hit each club, your driver, your different irons. It's about the short game, the percentage of hitting the green from different yards. And then it's the putting game. How many putts does it take at different distances to score? So everything's about metrics if you want to improve and hit your target. Well, in the vaccine distribution, metrics are critical as well. And we've been tracking on a global basis, and one of the best places to track information, I hope you'll put it up afterwards, is Bloomberg.
Yep.
And one of the great quotes that I resonate with, I know you do too, is from the great Peter Drucker: "If you can't measure it, you can't manage it." Mm-hmm. And Bloomberg's providing some of the best measurements that we have out there. So, as of today, 82.5, today is January 28th, 82.5 million vaccines have been administered in 59 countries around the world. And that's rising to about close to 4 million a day, which is good and it's growing. In the US, we've given 25.5 million shots, and we're averaging about 1.25 million a day, which is better than it was, and we're moving. Mm-hmm. And after yesterday's announcement, which I'll get into in a bit, we should be moving even further. But mm-hmm. What's important to me, and one of the things about metrics, is only 54% of the vaccines that are being distributed are actually being given. There's still 46% of the vaccines sitting somewhere. Mm-hmm. And, so that's what you do with metrics. The first one, why? And, what could we do about that? How could we get more of those doses into people's arms? And in second place is just, believe it or not, there are states that still are less than 50%. Kansas, Rhode Island, Alabama, even California haven't even given out 50% of the doses, which is kind of shocking, right?
Yeah. Oh, yeah. It definitely is. It's just one of those things where, again, the good statistician or the person who's paying attention to metrics should always be asking those questions. You know what I mean? Compared to what? Or what's the story behind that number,
And it's just been so hard to get good information. The Department of Health, and Human Services has a great website. We'll post that today as well. And one feature that I really like is you could track both the Pfizer and the Moderna vaccines state by state. First dose, second dose, what's been distributed, what's been allocated. Up to now, you've been able to see 1 week ahead. The president announced yesterday that they're going to provide visibility 3 weeks ahead to the states, which is going to make it easier for the states to manage. Now they'll know what's coming 3 weeks in advance,
sure,
which is huge, but still within a state,
yeah,
there's still all this uncertainty, right?
Yeah.
So what I'd like to see is much more detailed data, community level, what's coming to hospitals, to physicians, to the pharmacies, which they announced yesterday to be more coming to. Is it Rite Aid? Is it CVS? Who's going to have it? And the emergency areas, which they're going to be even more set up per the announcement yesterday. So there's a need to know where, but there's also a need to schedule. And this has been a
Scheduling.
disaster.
Yeah, it's a huge thing. And I think before the cameras were turned on, you were going to give me some good news about that for yourself, actually, right?
Yeah, I mean, what's the number one metric that people really want today? When am I going to get a vaccination?
Exactly.
That's the number one metric, right? And I was very fortunate today to get my vaccination approximately 2 hours ago. I got a Moderna vaccination, piece of cake, no reaction. I got to tell you, the hospital system was the highest quality. From the moment I walked in the door, information, stickers on the floor, where to go. Everybody was just so supportive.
Hmm.
Had my appointment for 4 weeks from now. So yeah, I mean, it's really, really important. And I was talking, you know me, I was going to get information, metrics. Hospital I went to, 192 doses a day. And this is part of Hackensack Medical Center,
Hmm.
one of the top in New Jersey.
Hmm.
But what they've been doing smartly is sharing amongst the different hospitals. So nobody's had to cancel a vaccination. I
Hmm.
mean, cancel an appointment.
Right.
But now they've held appointments, and they're really waiting on more vaccines. And this
Oh,
is why yesterday's announcement with more capacity, more orders from Moderna and
hmm.
Pfizer are critical.
Right.
And hopefully, really hopefully, Johnson and Johnson's vaccines approved, because that could be a game changer.
Yeah. Yeah.
One dose, and doesn't need the heavy lifting that the other vaccines have from the cold chain
Sure.
perspective.
Sure.
So, that to me, we're moving in the right direction, but it all depends where you are.
Hmm.
So I advise people stay attentive locally,
Hmm.
television, your network, uh, find out who's gotten a vaccine, where, how. It's probably the best thing you could do right now.
Excellent. And just to wrap up here, Sandy, typically we leave the people who watch this program with three big questions, three questions to ponder for the week. What are your three questions?
To me, from a business perspective, and it's real parallels here into supply chain and business. What metrics do you have in place today? And how do you use them for finance, for operations, for sales, for tracking customer satisfaction, for your employee satisfaction? Um,
Hmm.
Very, very critical.
Hmm.
Some companies don't do that. The second question would be, what are the sources of info that you have? How are you gathering that data? What's the quality of that data? How easy or challenging is it for you to uh, collate it and put together something meaningful from
Hmm.
it? And then the third I would say is, and this is really important, what critical information are you missing today which could help you achieve better results? For most people, when can I get a vaccination?
Hmm.
If they only could know that they could schedule an appointment and have some certainty, it would alleviate so much anxiety and
Hmm.
stress.
Hmm.
Same thing in a business. What critical information would help you sleep at night? A lot of executives are asked that question. What keeps you up at night, right?
Right. Hey, one thing that keeps us up at night is knowing that you folks can get at Sandy via his email address that you see on the screen there. So if you have questions or concerns or things you think he should be talking about on this program, please don't hesitate to email him with your stuff. Sandy, I look forward to next week. This has been really cool.
Great. Thank you so much. Great day.